Hey there, this is Dr. Zac Watkins, and first I want to say Happy Heart Health Month. February is that great month where it's dedicated to being aware of our heart health, and also Valentine's Day, we can't forget that. So with Valentine's Day approaching, I always think that there's no better way to show the ones that we love how much we care about them by truly taking care of our heart and being proactive in heart disease. Now, it's not a secret that cardiovascular disease today is still the leading cause of death in this country. And that also, it goes to show that why statin drugs are still the highest prescribed drug in the country as well. So obviously something's not working well, and we got to get to the bottom of this. You hear these stories, well, I have anyway personally, through mentors of mine and other colleagues, that you'll have marathon runners coming in who are just great shape, good health, run a lot, lots of exercise, taking statin medications because obviously we're trying to keep their cholesterol fairly low, yet they're still dying of heart attack or stroke. Obviously, this is not everyone, but if this was truly the answer for everyone, why are we still seeing these athletes who are still having problems? And, cholesterol levels have always been fluctuating when it comes to medical ranges and what's the best range, what's the high range, what's the low range. There was a time where the level of 250 of a total cholesterol was actually normal, and it started to drop to where 220 was the high, and now 200 is the high. And I think actually they're probably going to lower it again close to 180 or so. So now, it looks like most people are going to be on statin medications if certain people have their way. So, but I would really ask, as a functional medicine clinician, is that really the answer? Are we really truly preventing cardiovascular disease by lowering these cholesterol levels? We keep thinking the more that someone has, the worse it is. So we'll keep lowering the medical limits and put people on statin medications. So I would venture to say that it's not. My goal is to investigate individuals' health and to try to figure out what is the true cause and issue with cardiovascular disease. There's other factors that we talk about, like smoking is a factor, other medications, risk of or having diabetes is a problem too. So there's a lot of other things that we need to look at. So as I was saying, we're all familiar with going to our primary care physician's office to get routine cholesterol testing done. And typically we're told that our cholesterol levels are either normal or probably elevated, and because of that we need to start a statin medication. So very rarely do you hear people talk about having low cholesterol levels. And this is another topic for another day, but when I see low cholesterol levels, that's not a good thing. So if we start these statin medications for cholesterol, again, statin medications being the number one prescribed medication in America today, but I want to ask you still, is this sufficient? This is kind of where it ends. So my hope is to show you that it's not, because I believe it's not. And as we're not trying to be interested in the current disease status or even the symptom state that you have, we're really trying to figure out what has started this condition or this symptom in the first place. Let's get back to the root cause here. So today, I want to, share something special for you. I want to truly add value by showing you what I can and helping you where I can in your health journey. So what I've decided to do is show you my personal recent cardiovascular markers, what I believe should be done for a true cardiovascular workup. So I ran these on myself, and I wanted to take the chance and show them with you and show where I have missing links, which is common. I'm not perfect, but my hope is, myself, I've never done these on myself before, and I knew how important it was. So I wanted to really get to the heart of the matter and say, do I have cardiovascular disease risk? I do have a family history of diabetes and some stroke. So I wanted to see kind of what my markers showed. And I want to relay that to you if you're interested or not, but I wanted to at least show you, look, this is my markers personally I had done a few weeks ago, and what I believe is truly helpful in cardiovascular disease prevention. You know, the one of the things I want to take away from this, or have you take away from this, is as I go through these, I hope that you'll kind of take note and be able to take these to your primary care provider and inquire with them and say, you know, I've been doing some reading or I've been doing some research, and you know, I do have a family history of diabetes and heart disease. Can I be more proactive? Can I, you know, let's look at this more in-depth panel that may give us more answers. So I really encourage you that you'll be proactive in your health. I think that's going to be important, especially in today's society with, you know, healthcare changing, and you know, people are trying to be a little more proactive in their health these days. So again, thanks for this opportunity to be kind of honest and transparent with you, to kind of give you a glimpse into my own health. I'm sure I'll do it many more times because, you know, I like to find ways that I can improve my health. So why not share it with all of you, right? When we typically get a cholesterol panel, we usually hear about, you know, the total cholesterol panel, your good cholesterol, your, which is HDL, your bad cholesterol, which is LDL, and your triglycerides. That's pretty much it. You know, good cholesterol, really quick, is basically the cholesterol that's going to pretty much take cholesterol from your peripheral, like your arteries and you know, things like that, and bring it back to your liver, which is the healthy thing. And your bad cholesterol is believed to be taking cholesterol to your heart and to your vessels. And triglycerides is usually a dietary fat from your diet that you're going to be getting. So that's going to be an issue too. So as we go through this, what I want to do is go through some of these markers and show you the panel that I'm concerned about. When I break this down, one of the ways I want to describe this as, you know, we talk about LDL cholesterol, and what people don't know is that LDL cholesterol is kind of a broad term. It's like saying that I have a big pie, and there may be different sized pieces of the pie. You know, there's a big piece for those of us who really love the big, larger pieces, and then there's little, you know, small pieces that we, you know, cut off for the kids. You know, so we don't really know the full, you know, sizes of the pie. We know we have that big pie sitting there on the counter. Well, that's kind of like how HDL and LDL cholesterol is. So when you get our markers done, all we're knowing is the full size of the pie. But did you know that there's actually different sizes of the pieces of the pie that make a big difference? And that's huge, because you can have what's called smaller pieces of LDL cholesterol, which are actually more disease promoting, and you can have larger pieces or larger sizes of LDL cholesterol, which is not as concerning. So that's a pretty important thing. So basically, this comes down to what a lab I really recommend people getting done for themselves, which is called the VAP test, VAP. So this stands for Vertical Auto Profile Test, and it's pretty much was figured out by a doctor who's a director of atherosclerosis research at the University of Alabama, Birmingham. So it basically takes these cholesterol panels, or these pies, if you will, and just really breaks them down to see what are the different sizes of these pies, and that's what's important here. So there are a lot of acronyms, so bear with me as I talk about lots of acronyms here. So where we get into the big one is HDL. So HDL can be broken down in a couple categories here. So I'm going to go ahead and start opening my panel here. You'll see my VAP test right here. You can see the VAP cholesterol test. So you'll notice a lot of blue. These are all out of range. So you'll see I've got a lot of stuff going on here. So let's touch on this. Basically, he breaks down, you know, they talk about breaking down HDL particles into different categories. So you have HDL2, you'll see the large pieces of pie. You'll have HDL3, which is the small pieces of the pie. And what this means is HDL, so you have HDL total, which, where are we at? Right up here, which is a 46. And when they break it down, they say, okay, what makes that up? We know the number's 46. Ideally, yes, this is good. You'll see right here above 40. I like to see above 55, so I'm kind of low there. But when you break it down, you'll see down here that the large particles are a 9. Now just think of large as like large poofy clouds. They're very They're very bouncy and fluffy and very nice to look at. Whereas the small ones, HDL3, small particles are very just minute and they're not as fun to see. So we want large particles. They're very health protective, cardioprotective. And you'll see that my large particles medically are low. They're below 10. And then you'll see here the small particles are 37. So these are okay, but basically what it says is when we break down my good cholesterol here, I'm not as protective as I should be. My large particles here being 9. That's not a good thing. I want to bring these up. Another thing they break down here is they'll go through VLDL. So VLDL, which is basically just a calculation here. You'll see 29, so I'm barely within limit here. That basically, that can stand for very low density lipoproteins. So just seeing this number doesn't tell you a whole lot. Great, 29, what does that mean? Well, to make it simple, they have 3 different ones, LDL, or VLDL3, VLDL2, VLDL1. VLDL3 is the most important one, and that one is basically going to say if that's the one that's high, you're at a higher risk of cardiovascular disease. So look at mine, VLDL3, I'm at a 15, so strike 2 here. I'm not doing very well. My VLDL3, the one that's more puts you at higher risk of cardiovascular disease, is high, and my large particles of the good guys here are low, so that again puts me at more risk. So I've got a battle here to kind of deal with. Go up here, so you'll see. Let's look at my LDL cholesterol, and you'll see it's a 132. And they'll say that's high, we don't want to be above 130. I like to see, below 120, so yeah, I'm kind of getting up there. But what happens is when they break down this LDL cholesterol is, again, they're going to look at particle sizes. Are they going to have a larger size? Are they going to have a smaller size? The smaller size particles, again, remember, are the particles we don't want. The small size are not what we like to see. We like to see the big, poofy particles of the LDL cholesterol. So when they're looking at LDL cholesterol size here, that's why they're breaking these down here, the real LDL cholesterol and the sum total. So what they do is they break them down and they give us different patterns. So what it means is right here, if you're a pattern B, that means you have small, dense particles. Not a good thing. You don't want to be a B. If you have pattern A, you have bigger LDL cholesterol. You have large, poofier molecules, which is a healthier thing. Or you can have a mix between the two. And as you can see, I'm a mix between the two. We want to be A. I'm kind of right in the middle with my LDL cholesterol. So this is what I ask you. You look at your recent LDL cholesterol, whether you're on statin medications or not. Look at the number, and you're pretty much going to see this on your lab right here, this total LDL cholesterol. You'll see 132 or whatever your number is. Well, that's great, but it doesn't tell you, again, what does that mean? Do I have large particles or do I have small particles? Am I, really in a bad state, or am I, doing kind of so-so or okay? Well, like I said, I break down mine here, and it says here that I have, a pattern AB, which means I have kind of both small and large particles, which ideally you want to be A. But I think in my case, the big problem that I have to look at is saying that if I'm AB, right in the middle here, my protective cholesterol, again, the large, good cholesterol is low at 9. And my very low density lipoprotein is high at 15. So I still think the scale of prevention is being tipped in the side that I don't want to be. So I'm not happy with that at all. A couple other markers I'll touch on quickly. There's a lot of physiology behind it, but right here they'll say total ApoB1 protein. We want to see below 109. That's very good. That's another important marker that they look at. Lipoprotein A is another risk factor. If this is elevated, that's going to put you at high risk for stroke and cardiovascular disease. It's actually a pretty specific marker. And that looks good. That's below 10, so that's a 4. So good things I see there. I want to touch base up here in my other labs. Sorry for all the scrolling, and there's a lot of labs I've had done, which I will touch base on probably in the future, if you may want to know. Um, this glucose wasn't fasting. I just ate, so that's not fair to me anyway. Where are we at here? I wanted to show you. Okay, fibrinogen. This one right here, fibrinogen is a clotting marker. And this is important to look at a cardiovascular panel as well, because if you're above, so here's the reference range, 175 to 425. Honestly, I want to see everything below 300. So I'm even high for me. So if you have a higher level of fibrinogen, that means you have a higher activity of clotting. Your blood is more likely to clot. So basically, you have to think of it this way. If you're at a higher risk of clotting, your blood is a little more thick and sticky, and go down here, I have higher, I have higher or lower protection here with my good cholesterol kind of struggling and my bad cholesterol being a little high. I would say I'm at a greater risk. I'm at a higher risk for cardiovascular disease. I'm a higher risk for clotting and for stroke. So I definitely would say I'm in that category. Some place that I don't want to be at all. So I guess I don't want to say that worries me. I mean, I do want to make some changes, so I hope to make some changes here and show you some response. One other inflammatory marker I wanted to touch base and show you is this homocysteine. You might have heard of this before. It's basically an inflammatory marker, and it's in the body where we have a problem breaking down certain amino acids, usually because we're B vitamin deficient, like B6, B12, B9. Very important for brain health and blood sugar and things like that. Well, homocysteine is inflammatory. It's like a fire burning if you get buildup of this. For me, I like to see it usually below 7, sometimes 5. So this medically is a little high for me. But so if I want to see below 7, I'm at a 9. So I'm running high on this inflammation scale. And to me, that's where cardiovascular disease really sets in. It's not really, I have high cholesterol, so therefore I'm in danger. It's high cholesterol plus inflammation in other parts of the body due to different factors, which I can touch on with people. But so I have a little bit of high inflammation, and with high inflammation comes a higher possibility of clotting, like I said down here with fibrinogen being a little bit high, and then I have less protection with some of these markers down here, cholesterol. So you add all this up together, my scale is tipping on the side of, yes, I have some cardiovascular risk and I have some work to do. So I, being of the practice that with functional medicine and prevention, I'm not going to, prescribe any statins or look for statins. People need them sometimes. What I need to do is I need to pay attention to some dietary factors. I need to look at some inflammation control and where that starts, and to really try to control my what's called lipoprotein patterns here. So with all this, your typical panel usually is going to show here's your triglycerides, here's your regular cholesterol up here, and here's your LDL cholesterol. That's good to know, like I said, but hopefully I've shown you that you got to break this down. You got to know, well, if I have a certain number of good cholesterol, is it big protective marker or is it small protective? So like if they just looked at my good cholesterol here and it says 46, that says I'm good in their eye, medically, that my levels are good. And again, you break it down further and it says, oh look, it's actually not good because my large protective markers is low. And that's the one I want elevated. And my small is actually okay. So, but my large ones are not protective. So this number 46 is kind of deceiving. It tells me, yes, your good is okay, but actually when you break it down, it's not as what it should be. Same with my LDL cholesterol. That's my number, but when they break it down in these little patterns down here, at the real sizes of these pieces of the pie, if you will, I'm not the bad one, but I'm also not great either. So it's nice to know these because what it does is it can help guide therapy. Whether it's, the big point is having like a starting point. Because if you look at this down in the future, you want to know what you're doing. If you just see your total cholesterol drop over the years with statin medications or what have you, that's good, but is it really? Are you lowering your good cholesterol levels down here? Are you lowering the good particle sizes? You don't know unless you look at it. So I highly encourage you to recommend recommend your provider to see if you will run this test, the VAP cholesterol test, because it will break these things down. and it gives you a starting place where you may need to go in the future, and where you may need to, you know, target therapy or change some dietary habits. So that's a good thing. One other thing this does is, I forgot to mention here, it actually tells you, do you have a risk factor for metabolic syndrome? You know, metabolic syndrome is kind of those who are at risk for diabetes and who are overweight and insulin resistance. So this says I have no risk as of right now for my diet for diabetes or insulin resistance. You know, no, that's, you know, I wouldn't take that to the bank, because I think anybody can turn into insulin resistant if they don't watch it with the diet they eat and things like that. But so this is a nice panel that really breaks down and gives you a full picture of what you look like from a cardiovascular perspective. So I highly, highly, highly recommend you look over and talk to your doctor about the VAP cholesterol test, whether it be you to be preventative, whether it be you have history of heart disease, or if someone in your family has heart disease, or if you have diabetes or risk of diabetes. I will tell you, I mean, in my office, I see patients that, you know, we'll get levels like this back, or we'll get even just lipid panels back that are way skewed and not what they should be, and they didn't even know it. So this is what functional medicine is. It's being proactive, and it's trying to be preventative, because in the end, that's what's really going to save, you know, people time and money, being proactive, keeping themselves out of trouble, but also give us longer time with family and friends and the ones we love, and you know, helping us to be more productive at work and things like that. So I hope that serves you, and I hope that you enjoyed looking at my life here. I have some work to do. I'm obviously kind of stressed out and need to really, you know, take some time to reflect on what things I need to do for my cardiovascular prevention. So hopefully I can do this again and show you a difference, and an improved difference at that too. So I thank you for your time. I really encourage you. I know I covered a lot and there may be some questions. Please email the office, or probably easier to post some questions on Facebook if you have any, so I can go ahead and respond to those. But any way I can serve you, please let me know.